Today's topic is anatomy of larynx. I am Dr. Mohammad Sharjeel Ilyas, Assistant Professor, Postgraduate Medical Institute, Amiruddin Medical College, Lahore. Objectives of today's topic are functions of larynx, location and extent of larynx, dimensions of larynx, cartilages of larynx, very important, muscles and ligaments of larynx, neurovascular supply and lymphatic drainage of larynx, and applied aspects. Larynx controls passage of air into and out of the trachea. It comes in the upper respiratory tract through nose and enters into the pharynx and then into the larynx and through larynx inlet into the trachea. The muscles of the larynx can open and close the airway. In addition, they adjust the lax and tension of vocal folds needed for the production of voice. The larynx lies in the anterior midline of the neck, extending from the root of the tongue to the trachea. This is hyoid bone at the level of C1. This is laryngeal box, and this is trachea. In the adult male, it lies in front of the third to sixth cervical vertebra, but in children and in the adult female, it lies at a little higher level from C1 to C4 level. The most important portion of this presentation is cartilages of the larynx. There are 9 cartilages related to the larynx, 3 unpaired and 3 paired. 3 unpaired cartilages are thyroid cartilage, cricoid cartilage, and epiglottis, while 3 paired cartilages are arytenoid cartilage, corniculate cartilage, and cuneiform cartilage. Arytenoid is the most important among paired cartilages. Thyroid cartilage. The cartilage is V-shaped in cross-section. It consists of right and left lamina. This is lamina, while this is laryngeal prominence where these two laminas meet. This is also the reason of the protuberance on the anterior aspect of the neck in most of the males, that this laryngeal prominence is very prominent. It is also called Adam's apple. There is a notch which is called thyroid notch on the superior aspect of these two laminas where they do not meet. This is the side way of laryngeal cartilage or thyroid cartilage. The posterior portion of the lamina are free. Superiorly they are called superior carno, and inferiorly they extend and called inferior carno. Superior carno leads through thyroid membrane to hyoid bone and it makes connection, while inferior carno makes cricothyroid joint. This is the oblique line where very important muscles are attached. These are thyrohyoid, sternothyroid, and thyropharyngeus part of the inferior constrictor muscle. As we have discussed, the superior cornu forms a membrane by meeting with hyoid bone. This is called thyrohyoid membrane. This is its lateral part, or it is called lateral thyroid ligament, and this is the medial part, which is called medial thyroid ligament. This is the place where thyroid cartilage meets with cricoid cartilage. This is the second unpaired cartilage, and it forms here cricothyroid ligament, a very strong ligament and a part of very important structure. This is the joint which is called cricothyroid joint. This is the synovial joint between the inferior cornu of the thyroid cartilage and the site of the cricoid cartilage. It permits rotatory movements around a transverse axis passing through both cricothyroid joints permitting tension and relaxation of vocal cords. There are some gliding movements also. This is cricotracheal membrane joining cricoid cartilage to the first tracheal ring. Here we can see the second member of the unpaired cartilages, epiglottis. This is a leaf-shaped cartilage placed in the anterior wall of the upper part of the larynx. Its upper end is broad and free and projects upwards behind the thyroid and the tongue. The lower end of the thyroepiglottic ligament is pointed. This is thyroepiglottic ligament and is attached to the upper part of the angle between the two lamina of the thyroid cartilage. This is the lid which covers larynx when we eat or swallow food, while it is open, remains open while respiration. This is the third member of the unpaired cartilages. This is called cricoid cartilage. It is shaped like a ring and is a complete cartilage. It encircles the larynx below the thyroid cartilage and forms foundation stone of larynx. It is thicker and stronger than the thyroid cartilage. The ring has a narrow anterior part called arch and a broad posterior part which is called the lamina. Lamina projects upwards behind the thyroid cartilage and articulates superiorly with the arytenoid cartilage. This is also represented as a signet-shaped ring. These are arytenoid cartilages. It's a pair of cartilages and very important. These are two small pyramidal-shaped cartilages lying on the upper border of the lamina of cricoid cartilage. The apex of the arytenoid cartilage is curved and articulates with the corniculate cartilage. Its base is concave and articulates with the lateral part of the upper border of the cricoid lamina. Base is prolonged laterally and forms muscular process. This is very important to remember. This base is also prolonged anteriorly to form the vocal process. These two processes, vocal process and muscular process, you need to remember them just to understand the movements of muscles related with the vocal cords. This is cricoarytenoid joint where the base meets with the lamina of cricoid cartilage. The synovial joint, it permits rotatory movements around a vertical axis, permitting adduction and abduction of the vocal cords, and also gliding movements in all the directions. These movements around this joint are also very important. This is a pair of corniculate cartilage residing on the apex of arytenoid cartilage. There are two small rod-shaped pieces of cartilage placed in the epiglottic fold, just ventral to the corniculate cartilage. They are called cuneiform cartilages. Now we'll start with the membranes. This is quadrangular membrane, a very important membrane. Its superior border. First of all, we will deal with the attachments. This membrane is attached along the whole posterior border of epiglottis and anterior border of arytenoid cartilage to arytenoid cartilage. This is another picture of epiglottic fold. This is the lowermost part of quadrangular membrane, which is called vestibular ligament. Vestibular ligament is also called false vocal cord. This is the vestibular fold. The area between the vestibular fold and the lower vocal fold is called the sinus. This is vocal ligament coming out from the vocal process of arytenoid cartilage and attaching itself to the interior surface of thyroid cartilage where two laminas meet, just below the attachment of thyroepiglottic ligament. This is very important ligament and it forms true vocal cord. This is the vocalis muscle just around this vocal cord. Now the area between this vocal cord and vestibular cord or vestibular fold is called the sinus, and the membrane above the sinus is called quadrangular membrane, while the membrane below the sinus is called conus elasticus. As you can see, the superior border is formed by vocal cord, while inferiorly it is attached with the arch and lamina of cricoid cartilage. The cricothyroid membrane, a very strong membrane, is a part of this conus elasticus. Now you can appreciate vocal folds and vestibular folds. Vestibular folds are just above, while the vocal folds are just below, and the area between them is called the sinus, and the opening is called rima glottidus. This is the airway. Now the muscular part of the larynx. This is very important muscle which is called cricothyroid. It is originated from cricoid cartilage anterolaterally and inserted into inferior horn of thyroid cartilage and inferior margin of the thyroid cartilage. As it acts on cricothyroid joint, and cricothyroid joint has ability for a little rotation. So the contraction of this muscle causes thyroid cartilage to move farther from arytenoid cartilage present posteriorly. So it draws thyroid cartilage antero-inferiorly, lengthens and tenses vocal ligament for high-pitched sound. This is the only tensor of all the muscles of vocal cord. This is the only muscle which is supplied by vagus nerve, superior laryngeal nerve, branch, external laryngeal branch of vagus nerve. All the other muscles are supplied by recurrent laryngeal nerve. This is another important muscle which is called posterior cricoarytenoid. It is attached to the lamina of cricoid cartilage while inserted into the muscular process of arytenoid cartilage. If you want to understand the movement of this muscle, you may uh, need to make the position of your hands like shown in the picture. And these thumbs, they represents muscular process of arytenoid cartilage, while the little fingers, they represent the vocal cords, and your arms, they represents lamina of cricoid cartilage. So acting on the arytenoid cartilage like this, a little rotatory movements by the contraction of this posterior cricoarytenoid muscle causes abduction of vocal folds. This is lateral cricoarytenoid muscle. It is originated from superior lateral margin of cricoid cartilage, while its insertion is in muscular process of arytenoid cartilage. Again, the same hand movements. The thumbs are showing muscular process of arytenoid cartilage, while the little fingers, they represents the vocal folds. Now the origin is anterior to the muscular process, So contraction of this muscle causes adduction of vocal folds. This is oblique arytenoid muscle. Origin arytenoid cartilages, incision contralateral arytenoid cartilages. This means apex of one cartilage and the base of the other cartilage. Now, action is adduction of vocal cords by combining two arytenoid cartilages. Same is the case with transverse arytenoids, origin from arytenoid cartilage, insertion from contralateral arytenoid cartilage, and they also adduct vocal folds. This is thyroarytenoid. From arytenoid cartilage to the thyroid cartilage. And action, it relaxes vocal ligaments by shortening the passage. These are four different situations of vocal cords. Now you can easily imagine the adduction and abduction by movements of arytenoid cartilages. Now the blood supply of larynx, superior laryngeal artery, which is a branch of the superior thyroid artery, and this is derived from the external carotid artery. It also follows the internal branch of the superior laryngeal nerve into the larynx by piercing thyrohyoid membrane laterally. Inferior laryngeal artery, a branch of the inferior thyroid artery, it is derived from thyrocervical trunk. It also follows the recurrent laryngeal nerve into the larynx by piercing cricothyroid membrane. Venous drainage, superior laryngeal vein, drain to superior thyroid vein, and then to the internal jugular vein. But inferior laryngeal vein drains to inferior thyroid vein and then to brachiocephalic vein. Lymphatic drainage, very simple. Above vocal cords, upper deep cervical lymph nodes, and below vocal cords, lower deep cervical lymph nodes. Vagus nerve is the main supply where superior laryngeal nerve, the branch of vagus nerve, comes out and divides into external laryngeal and internal laryngeal nerve. External laryngeal nerve supplies cricothyroid, the only muscle supplied by external laryngeal nerve, while the internal laryngeal nerve gives sensory supply above the vocal folds. The second is recurrent laryngeal nerve. It has a long course and there is a difference in the course of right recurrent laryngeal and left recurrent laryngeal nerve, and it supplies motor as well as sensory supply. Motor supply to all the muscles except cricothyroid muscle, and sensory supply below the vocal folds, including vocal cords. Now, there are different clinical aspects of injury to the nerve, like injury to the recurrent laryngeal nerve during thyroid surgery or any other surgery, or tumor surgery. If one of the nerve is injured, the vocal cords or folds of that side paralyze and become in cadaveric position. And if both of them are injured, then they both of them comes into a relaxed or cadaveric position,